According to the American College of Sports Medicine, 300,000 sports and recreation-related concussions are diagnosed nationwide each year. But they also estimate that the actual number is probably 7 times more because so many concussions go undiagnosed. We spoke to Dr. Koutures at Children's Hospital of Orange County, who gives us more information and explains the difference between a little bump on the head and a concussion.
A concussion is any blow to the head or to the body that causes a change in the way somebody thinks, acts, or behaves. Now, a bump in the head is maybe just that. A bump, they have a little bit of swelling, they're acting fine, they're playing fine, everything else is normal. Short of that, anything else has changed, I'm going to call that a concussion.
We asked Dr. Koutures about the symptoms of a concussion.
The most common symptom is headache, maybe fatigue, dizziness. Kids will tell me they feel slower in a fog. Parents may notice that they're more sensitive around light or noise. And they can be obvious. The kid who's knocked out, that's probably the easy one. But then there could be the kid who's just acting differently, maybe not as alert, maybe not as apt to get up in the morning. I'm amazed how people will sometimes come to my office. A girl I saw yesterday, 2 weeks since getting hit in the head. Headaches every day, dizziness in the classroom, decreased school performance. Pretty much suspected she had a concussion but wasn't sure. Finally went to her school-based trainer, got diagnosed, came to see me. I think some kids just want to get through it. They want to play through it. They don't want to embarrass themselves. They don't want to be held out, so they keep going.
And how do kids follow the recommendations for treatment of a concussion?
First thing we do is identify the main symptoms. I want to identify to the child and his or her parents what we're dealing with. What I know is that if we can shut them down, both physically and mentally, we can hopefully make those symptoms go down. And I tell them they're not going to go home and text all their friends. They're not getting on the internet. They're not listening to music. They're going to be bored. So when I see them in follow-up, I want to hear the word boring. I didn't do anything over the weekend. I didn't play any sports. I slept in more. I was in a dark room. Hopefully that gives the brain a chance to heal. Those kids who do comply, those kids who try to slow things down, I think do better. It's not uniform. I wish I could say dose response. If you're really good, you're going to get better. But as a rule, they tend to get better.
We wondered about any long-term effects of a concussion.
There can be long-term effect from a concussion, and it's hard to predict day one, week one. I wish I could get my crystal ball and tell a family. What we know is the more we can protect the child in those first few days, the less chance that that's going to happen. Long-term issues could be personality changes, decreased grades, depression, memory changes. So we can't predict, but again, the more we protect early on, the less chance we think those things are going to happen.
What kind of hit to an athlete can cause a concussion?
Kids get concussions from getting hit in the head. There's the obvious, you're watching a game, kid uses his head to make a tackle, down he goes. Those are pretty obvious. I've had kids who were dropped as cheerleaders, hit the back of their head. I've had kids who had locks thrown at them in the locker room. I've heard it all. So it's usually some type of blow to the head or multiple blows. Some kids will say, I didn't get one, but maybe 3 or 4 in a row. Some data now suggesting it's cumulative. The kid who just gets hit and hit and hit, eventually the brain reaches a threshold, we've got a concussion. It is indeed the brain hitting the skull. That's one way. Also, the nerves are getting stretched. The nerves are getting traumatized, and that's causing the symptoms. So it depends on how the athlete gets hit. There's the direct blow, which causes it. There's the rotational blow. Both times either the brain hits the skull or the neurons get stretched.
And most importantly, how can a concussion be prevented?
First of all, it's wearing the proper equipment. No helmet by itself is going to prevent every concussion, but it may prevent the direct on blow. Technique, teaching kids how to use their heads properly. Just because you're wearing a helmet doesn't give you license to go snowboarding down the hill at 70 miles an hour. Does not give you license to lead with your head in hockey or football. Finally, rule enforcement. If we could talk to the officials of the world and say, look, in a soccer match, if you're going to call the elbow to the head in that first couple minutes, the game is going to be less physical, less chance of head injury. So it's a matter of using your head properly, enforcing the rules, and not doing crazy things.